1. During the EFMB testing phase, what is the primary purpose of the lane safety officer? A. To grade the candidate's performance on medical tasks. B. To ensure all safety protocols are followed and intervene if necessary. C. To provide hints and guidance to struggling candidates. D. To record the time taken for each station completion. 2. Which of the following is a mandatory prerequisite for soldiers attempting the EFMB test? A. Completion of Advanced Individual Training, AIT only. B. Current Basic Life Support, BLS certification and passing a physical fitness assessment. C. At least 2 years of active duty service. D. Prior deployment to a combat zone. 3. What is the maximum time allotted for candidates to complete the written examination portion of the EFMB? A. 60 minutes. B. 90 minutes. C. 120 minutes. D. 150 minutes. 4. In the EFMB day-night land navigation testing, what is the passing standard? A. Find 3 out of 4 points during day and 2 out of 4 points at night. B. Find 4 out of 5 points during day and 3 out of 5 points at night. C. Find 3 out of 5 points during day and 2 out of 4 points at night. D. Find 4 out of 4 points during day and 3 out of 4 points at night. 5. Which training principle is most important when preparing some soldiers for the EFMB's high-stress testing environment? A. Massed practice, intensive training in short bursts. B. Distributed practice, spreading training over extended periods with repetition. C. Passive learning, lecture-based instruction only. D. Observational learning, watching videos without hands-on practice. 6. During the EFMB patrolling phase, what is the consequence of a candidate failing to maintain noise and light discipline? A. Verbal warning only. B. Point deduction from final score. C. Immediate failure of the patrol phase. D. Required to repeat the specific task. 7. What is the minimum passing score for each testing lane during the EFMB medical task testing? A. 60%. B. 70%. C. 80%. D. 100%, go, no-go standard. 8. Which adult learning principle is most violated when EFMB training relies solely on PowerPoint presentations without practical application? A. Readiness to learn. Self-direction. C. Experience-based learning. D. Problem-centered orientation. 9. In EFMB curriculum development, what is the recommended ratio of hands-on practical training to classroom instruction? A. 25% practical, 75% classroom. B. 50% practical, 50% classroom. C. 75% practical, 25% classroom. D. 90% practical, 10 PerkNet classroom. 10. What regulatory publication provides the official standards and procedures for EFMB testing? AAR 600-822. BAT 442. C. DABPAM 3. DFM 4511. 11. During EFMB testing, what is the proper procedure if a candidate believes a grader made an error? A. Immediately argue with the grader during testing. B. File a formal complaint after completing all testing phases. C. Request clarification through chain of command after the specific station. D. Accept the grading without question as all decisions are final. 12. Which communication technique is most effective when mentoring a soldier who failed their first EFMB attempt? A. Pointing out all mistakes immediately to prevent future errors. B. Comparing their performance to successful candidates. C. Using reflective questioning to help identify improvement areas. D. Suggesting they wait several years before attempting again. 13. What is the standard for the 12-mile foot march during EFMB testing? A. Complete in under 3 hours with 35-pound rucksack. B. Complete in under 3 hours with full combat load. C. Complete in under 4 hours with 35-pound rucksack. D. Complete in under 4 hours with full combat load. 14. When evaluating a candidate's performance on IV insertion during EFMB testing, what constitutes an automatic failure? A. Taking longer than 3 minutes to complete the task. B. Failing to maintain sterile technique. C. Requiring verbal prompting from the grader. D. Not verbalizing every step of the procedure. 15. Which formative assessment method is most valuable during pre-EFMB training? A. Final written examination only. B. Regular hands-on evaluations with feedback. C. Peer assessment without instructor oversight. D. Self-assessment checklists completed independently. 16. What is the purpose of the EFMB pretest phase? A. To award points toward final EFMB qualification. B. To identify candidate weaknesses and provide remedial training opportunities. C. To eliminate the weakest candidates before formal testing. D. To determine lane assignments for the testing phase. 17. In applying Bloom's taxonomy to EFMB training, which cognitive level is required for successfully treating attention pneumothorax? A. Knowledge, recalling the steps. B. Comprehension, understanding the condition. C. Application, performing the needle decompression correctly. D. Analysis, comparing various treatment options. 18. What is the maximum number of attempts a candidate receives at each medical task testing station during EFMB? A. 1 attempt only. B. 2 attempts with immediate retest. C. 3 attempts with remediation between. D. Unlimited attempts within the time limit. 19. Which regulation governs the wear and display of the Expert Field Medical Badge? AR 601, BAR 608-22, CAPAM 671, both A and B. 20. When designing EFMB preparatory training, which instructional strategy best addresses different learning styles? A. Lecture-only approach for consistency. B. Multimodal instruction combining visual, auditory, and kinesthetic methods. C. Reading assignments exclusively. D. Computer-based training modules only. 21. During EFMB testing, what is the policy regarding retesting for candidates who fail a particular phase? A. Immediate retest the following day. B. Must wait 6 months before attempting EFMB again. C. Must restart the entire EFMB test from the beginning. D. May continue if passed enough other stations to meet minimum requirements. 22. What is the primary purpose of having multiple graders observe and evaluate the same EFMB station? A. To speed up the testing process. B. To ensure inter-rater reliability and consistency in evaluation. C. To intimidate candidates into performing better. D. To reduce the workload on individual graders. 23. Which mentoring technique is most effective for building confidence in soldiers preparing for EFMB? A. Focusing exclusively on areas of weakness. B. Providing positive reinforcement for demonstrated competencies while addressing gaps. C. Comparing them unfavorably to previous successful candidates, allowing them to figure out solutions independently without guidance. 24. What is the consequence of a candidate receiving outside assistance during EFMB testing? A. Point deduction for that station. B. Verbal warning for first offense. C. Immediate disqualification from EFMB testing. D. Required to repeat the specific station only. 25. In EFMB training curriculum development, what is the recommended frequency for conducting full dress rehearsals? A. Once at the beginning of training. B. Once at the end of training only. C. Multiple times throughout the training cycle with increasing complexity. Dress rehearsals are not recommended as they cause unnecessary stress. 26. Which physical fitness component is most critical for success in the EFMB 12-mile ruck march? A. Maximum upper body strength. B. Cardiovascular endurance and lower body muscular endurance. C. Flexibility and agility. D. Maximum sprint speed. 27. When evaluating casualty assessment during EFMB testing, what is the expected standard for patient questioning? A. Sample history must be obtained. B. Only chief complaint needs to be identified. C. PAR format must be used. D. No specific format required as long as information is gathered. 28. What is the Army regulation that establishes the EFMB program and eligibility requirements? AAR 351, BAR 600 822, CTC 8800, DATP 41. 29. Which evaluation method provides the most valid assessment of a candidate's ability to perform under EFMB testing conditions? A. Written multiple choice examinations. B. Verbal questioning by instructors. C. Performance-based testing in simulated conditions. D. Self-assessment questionnaires. 30. During EFMB training, what is the most effective way to provide feedback to improve performance? Wait until the end of all training to provide comprehensive feedback. B. Provide immediate, specific, and actionable feedback after each performance. C. Only provide feedback when mistakes are made. D. Have peers provide all feedback without instructor involvement. 31. What is the primary difference between formative and summative assessment in EFMB training? A. Formative is for training improvement. Summative is for final qualification decision. B. Formative is written tests. Summative is practical tests. C. Formative is conducted by peers. Summative is conducted by cadre. D. There is no difference. The terms are interchangeable. 32. Which leadership quality is most important for EFM test administrators to demonstrate? A. Strict enforcement without flexibility or explanation. B. Fairness, consistency, and adherence to standards while maintaining candidate dignity. C. Befriending candidates to reduce stress levels. D. Demonstrating superior medical knowledge through constant corrections.